Endovenous laser ablation are often referred to as ELACE. ELACE is a simple outpatient procedure performed here in our office using a local numbing medication. We do ask that you have a driver as a safety precaution. However, you will be able to walk out of the office following the procedure without any difficulties. Valium is optional and can be prescribed to your local pharmacy if you're anxious about the procedure. ELACE is a clinically proven, FDA-approved technique that permanently eliminates varicose veins. This procedure is performed under local anesthetic and causes no damage to the surrounding tissue. Using an ultrasound for guidance, a very small puncture is made and a thin laser is inserted into the damaged vein. The laser then creates heat that causes the vein to collapse and the laser is removed. The abnormal vein is then closed off so that the blood flow will redirect through the healthy veins in the leg. Microphobectomy is a method of removing very twisted varicose veins on the surface of the legs. The procedure involves making tiny punctures through which the veins are removed. This procedure is performed under local anesthetic and the incisions are so small that no stitches are typically required. We often combine this procedure with the ELACE. Microphobectomy is not always necessary and is typically only performed on large ropey veins. Following your ELACE procedure, you will be leaving the office in a compression garment. If you are having an ELACE only, you will leave your appointment in your compression stocking, so please bring to your appointment with you. If you are having an ELACE and a microphobectomy, you will be placed in a compression wrap. You will sleep with the compression wrap on for the first night and remove in the morning. You will be able to shower the following day after your procedure and then place your compression stocking on. You will be required following your procedure to wear a full thigh-high medical grade 20/30 compression stocking for 2 weeks following your procedure. It is required to sleep in compression for the first 2 nights, and thereafter you can just wear your compression during the daytime. We will measure you today in office to make sure that you have the proper fitting compression sock. Compression stockings can be purchased from our office, or you're welcome to look elsewhere. It is normal to have some bloody drainage following your procedure. If you have excessive drainage or significant swelling or any other concerns, please feel free to contact the office. We do recommend that you take over-the-counter ibuprofen, 400 to 800 milligrams daily, for a minimum of the first 5 days following your procedure. We typically do call in a prescription for a low-dose narcotic, which is strictly for pain, but is not necessary. Voltaren topical gel can also be used along the area of the treated vein. Very important to keep all punctures clean and dry. You will have restrictions following your procedure for 2 weeks. You will not be able to travel. This includes air travel or driving for more than an hour. No exercise, including heavy lifting or strenuous activity, or anything that elevates your heart rate. No soaking in hot tubs, bathtubs, or swimming pools. Showers only for the 2 weeks following the procedure. Starting immediately after your procedure, it is important that you're up and walking 10 to 15 minutes every hour for the first 2 weeks. We will ask that you return to the office in 2 to 7 days following your procedure for a brief ultrasound to confirm closure of the vein. Thereafter, we will have you return in 6 weeks for a reevaluation and new measurements to determine if further treatment is necessary. Most people will need additional cleanup of smaller veins using ultrasound-guided sclerotherapy. Ultrasound-guided sclerotherapy treats varicose veins that cannot be treated with a laser. A sclerosant solution is injected into the abnormal veins, and the veins will close. Over time, the veins will absorb and disappear. The treatment is performed under ultrasound guidance, so the solution is placed precisely at the root of the problem vein. You will be in the office for around 30 minutes and will be able to drive yourself home. Insurance approval is required for your procedure. Authorization typically takes 2 to 3 weeks, and you must have a scheduled date in order to request authorization. Please keep in mind that we do have a cancellation policy. You will be charged $200 if you cancel your procedure within 2 weeks of the scheduled date. Your treatment plan and pre- and post-procedure instructions will be sent home with you today. If you have any further questions or concerns, please address them with your nurse.